I'm Donald McCauley and welcome to medicsvoices.com, where we talk to the key opinion leaders in health and medicine around the world. Today I'm talking to Joanne Roberts. Joanne's had the fascinating career. She's been a very successful doctor, palliative care doctor, administrator, editor of the BMJ, and indeed editor of BMJ USA. So it's been a remarkable academic and medical career. But it's been a life with a difference. Joanne, tell us your story.
Gosh, well, where do you begin a story, right? I grew up in the South of the United States and ended up in Ferguson, Missouri, that famous place, Ferguson, Missouri, which has been in the news in the last few years, but always grew up with a big secret and kept that secret from my family, kept that secret from my friends, and managed to somehow struggle through school, pretty quiet, didn't stand out on purpose, and ended up flunking out of college. And my father had wanted me to be a physician, but I decided after flunking out of college that wasn't going to happen. So off I went and became a journalist, a newspaper journalist. And I loved it. I loved being a journalist because I got to tell the stories of other people's lives because I didn't want to tell my own story. So I enjoyed telling other people's story. But after about 8 years of doing that, I actually found myself writing more and more about healthcare and decided I actually would go to medical school and did. And I was successful in medical school. And it was during medical school that I finally became honest with the secret I'd been holding all my life, and that is my transgenderism. Back then it was called transsexuality. And I just felt that I was it's overly simplified to say that I was living in the wrong body. I don't think that's a very good description, but that's what people say. And that describes the discomfort anyway, that I was always ashamed of myself. I was always holding secrets. And I finally came out, went to a program in human sexuality at my medical school. I was quite sure when I came out that I was transgendered, but the experts back then had different diagnostic criteria than they do today. So they interviewed me several times. At the end of the interviews, they said, "You don't meet our criteria for transsexualism." Because the criteria back then were you had to present yourself in public as extremely feminine, which I'm not. I'm a pretty androgynous person. You had to be, quote, straight. That is, I had to be seeking men as sexual partners and marriage partners, which was probably not true. And I had to drop out of medical school because, of course, people like me couldn't possibly be doctors. So I listened to the experts. I said, well, they know more than I do. And so I told myself, well, I'm just an androgynous man. And off I went, finished up medical school, finished up my residency. And I went into internal medicine and then palliative care. And oddly enough, it was during my years doing palliative care that this all came together again. After about another 15 years, and after working for the BMJ during that time, I was doing palliative care and taking care of patients at the end of life. And one of the things that I found to be fairly universal about people on their deathbeds is on their deathbeds, they let go of their secrets and their shame. And I was just so impressed by that. It was talking with people, talking with farmers who really had never been sick and they were, tough guys. And then on their deathbeds, they would become extremely vulnerable and say, I've never told my wife that I'm a drinker on the side. And, I've always held this secret. And it was just patient after patient after patient. And after taking care of patients like that for a few years, I thought, why should I be on my deathbed before I tell my secret? And then came out again with this gender issue. And in the meantime, over those 20 years, the science had changed. And suddenly I met all the criteria for being transgendered. And I ended up transitioning around the turn of the century. And life has been wonderful since then. And if someone asked me, well, why has life become so much better? I would say, before I transitioned, I constantly worried about what people would discover about me. And it was all about me. And after I transitioned, it was me actually worrying about other people. And I became a much, much better doctor because I had nothing to hold secret. I could talk about anything. I could make eye contact for the first time. And it was odd because people would say, you have a magnificent way of holding eye contact that I've never seen before. And it was because I had learned just to be present with people rather than trying to, keep myself hidden. So that's my personal story, and it overlaps with my professional story.
Let me take you back a little bit, because
Sure.
when we have this conversation now, it's easy to have this conversation. This is the language that that's maybe unfair. It's not easy for many people, but it's easier. But you were so far ahead of the game. I mean, when you say the turn of the century, you're actually taking us way, way back to even before that. It must have been so difficult. How did you cope with that?
As I say, I just kept myself hidden. For those of us who are old enough to remember, when I first started discovering about transsexuality, I was probably about 14 years old when I first discovered the word. And these were the days of Christine Jorgensen. I don't know if you remember that name, but that was a tabloid. She was a woman who served in World War II, and she was a tabloid sensation. And this was scandalous. This whole idea of being a transsexual was just scandalous. The thought of having that kind of notoriety was just terrifying to me, and being pushed to the margins of society. I wanted to fit in, like we all do. I think we all hold secrets. I think that's a universal thing. We all have our own closet, but it was a pretty big closet, and some people I came out to could not handle it. I mean, I was married. I was married twice. I was married young to a woman, and when I went to medical school and went through that process, we divorced about that time for my gender confusion. That was the cause. And then trying to live androgynously as a man, I got married again, and yet when I came out the second time, that ended up as a divorce, and I had children by then. And both times, I mean, my first partner, my second partner, it has been hard for both, but we've maintained some contact. Parents were great when I came out. But what I think shocked me the most was my colleagues universally embraced me, universally. When I finally did transition, I was living in Bellingham, Washington, far up into the northwest corner of the United States. And I was working there, and we had decided I would move an hour or so away from Bellingham to give my ex-wife some space. And I didn't think I was going to be able to work as a doctor, but I interviewed anyway. The day I interviewed was the first day I ever walked out of the house as a woman. That day of the interview. So I on many levels, that interview was terrifying. So interviewed for the job. The next day, the medical director called me back and offered me the job. And I said, before you offer me this job, John, I need to tell you I wasn't born a woman. And he said, so what? And that's been pretty much my experience with the medical community. It's never been a secret that I'm transgendered. The odd thing about coming out of a closet is once you come out, you don't know who knows. And I tell people, I don't care what you share about me. Tell people my history is perfectly fine. I have no secrets. And then I find out years later that the person I've been working with for 5 years didn't know. It's been a fascinating journey that way.
It's really interesting to hear that medical colleagues, and medicine being such a conservative profession, were able to deal with that so well.
Yes, but physicians also ask questions, and I often think of my most conservative colleague, a Christian conservative gentleman, who I adore. He was fearless in asking me questions. He said, I don't understand this. And he would just sit down with me and say, tell me about your life and how you came to this. And we ended up, because he was just so curious, we ended up being dear, dear friends. Of all of my colleagues, I think I've had one I remember pushing back. And she was a very liberal psychiatrist friend that I had known for a long, long time. And she heard the story, and her response was, well, you've just ruined your children's lives. That was her response. So,
Goodness.
Yeah.
Let me just ask you, because you talked about the sort of curiosity of your colleague, one of the questions that troubles a lot of doctors at the moment is, and you described it very nicely when you were 14. So now we're so open now that very often teenagers come to their doctors and say, so what is your advice?
Oh, God.
Put your head as an expert patient now. What is your advice to those doctors? How is best to deal with that?
I think this is a terribly difficult circumstance. I really do. And I have other physician friends who are transgender, who've gone through their transitions. And we all share this concern about teenageship, adolescence is meant to be a time of exploration and to push boundaries. That's what it's for in our life cycle. And I do worry about teenagers making decisions that could be permanent. I mean, I think, counseling is great. I don't know the science right now of hormone blockers, but I just think we need to walk with care, respect them, listen to them, let them explore those boundaries, but maybe not make decisions that are irreversible. That said, I have a friend who has a child who at age 3 was clearly transgendered. I mean, it wasn't even subtle. And that child is now probably about 8 or 9. Born female, absolutely masculine in every way. And to withhold treatment for that child, I don't know. I mean, there's such a spectrum. And I think it takes great therapists and physicians to pick apart, which child is exploring and which child really is, they were born this way, no question. Tough.
Let's change tack a little bit, because very often people will say, I've had this terrible question in my life. I've had some trauma in my life that held me back in my career, that I didn't fulfill my potential. But you couldn't say that about you. You've had an immensely successful career. So was there anything, did they relate? Did they interact? How did this issue affect your professional career?
Yes. Well, I try to, that's a great question. I mean, in so many ways, it opened up my life. And I think it is because I was, like I said earlier, my focus before I transitioned was on me, holding my secret. And after I transitioned, I opened up and my world was about we. And I was able to look way outside myself. And we all suffer trauma. I went through a phase of victimhood, like many of us do, when I was younger, probably in my 30s. Poor me. But I attempted suicide one time and failed, and that was really a milestone in my journey, because that's when the doctors re-diagnosed me with gender dysphoria. But it's once that world opened up, all that victimhood just seemed to go away. And I just became so much more interested in other people than myself. I will say there's one thing I have talked about with Richard and other friends of being a physician leader as a woman versus a man, and having been socialized as a man, but now living as a woman, and recognizing how powerful receptive leadership can be. And I think my friends who are women who were born women, they struggle with that socialization of being receptive, and often see leadership as more of a masculine, command control kind of leadership. And my experience has been, if I use the same skills as I do in palliative care and just keep my mouth closed and ask questions and use silence, I can get a whole lot more done from people than if I try to tell them what to do. So in many ways, I found that a feminine way of leading is a much more powerful way of leading. And at the same time, we have to recognize that sometimes the command and control people win out. They do. So that's life.
Now, as we were chatting there, you talked about your career in palliative care. You've had to face illness yourself. How has that been?
I would say it has been the best 2 years of my life. Since I was diagnosed 2 years ago last month with myelodysplastic syndrome. I had been 6 months into retirement, and just a routine blood count. And when it came back, I'm an internist. I knew pretty much what it was going to be, and it was confirmed pretty quickly. I opted not to undergo a bone marrow transplant. I told my hematologist, who is my age, which I think is really important because he's not afraid of death. I told him the first day, I want you to hear this. My goal is quality, not quantity. So good life is more important than long life. And he heard that, and I've undergone what used to be standard chemotherapy that is very tolerable. I mean, it just barely any side effects. For physicians, it's HMA inhibitors that I get every day for a week each month. And I've done well. My counts have held up, and I've lived every day with such gratitude that it's hard to describe. But I wake up every day. I used to wake up every day when I was working, and I had instant anxiety about, oh my God, what is going on? What do I have to do today? These days I wake up, I am at such peace when I wake up. I meditate. I do only the things that give me joy. which is connecting with friends, biking, hiking, reading, writing, doing some coaching with young physician leaders, especially young women physician leaders. That is my life, and it's terribly full and overwhelmingly joyful.
When we come towards the end of one of these conversations, I generally ask, what would you say to other people about whatever aspect of your career it is? But I'm kind of stuck, Joanne, because you have so much to talk about. So I'm sure you've thought about what your message would be to people.
When people ask me, what does a successful leader look like? And I say a successful leader is perseverant and never gives up. And I guess that would be a summation of my life, whether it's my personal life or my professional life. It's just never give up and keep going. And at the same time, appreciate each day as it's given to you.
Joanne, it's been an incredible privilege to talk to you. Thank you very much indeed.
Oh, well, thank you, Donald. Really appreciate it.